Ladies and gentlemen of the bailiwick and beyond, good afternoon and welcome. This is our updated and most recent briefing on COVID. As you can see, the venue is different. We're all self-isolating in the sense that we're all in our own homes or offices, as the case may be, rather than at Beaux Jours. So we hope the technology works. I'm very grateful to all the staff who put in a tremendous effort to make sure that it will try and work. A lot of people, of course, have been used to dealing with Teams or Skype or whatever, and this will follow that format. Today, with me on the panel are Dr. Brink, of course, Deputy Heidi Salisbury, Deputy Al Brouard, and the Chief Executive, Paul Whitfield. So, in due course, my colleagues will make a contribution. But let me just say this. This has undoubtedly been a challenging time for everybody in the bailiwick and will continue to be so in the days and weeks going forward. Now, our case numbers are, sadly, slowly rising, but the good thing is that they are rising slowly rather than vertically at the moment. But many more people have been tested or are self-isolating, and Dr. Brink will update you shortly on the requirements and duties and best manners forward of self-isolation. Now, the test, track and isolate strategy remains central to our response, but it's having to evolve quickly and things are changing daily and sometimes hourly. And Dr. Brink will again explain more about what we're doing and why. Now, we want to clear up any misunderstanding. Before I hand over to Dr. Brink, I speak now just as President of Policy and Resources, but the Vice President of Policy and Resources is also a member of this panel and a member of this call. We're very appreciative of the comments made, and some of those are concerns about the financial packages, particularly but not limited to payroll funding. Now, our package is based on there being a short and sharp lockdown. It will be a severe lockdown in the sense of the way that it's going to be operated, but we want it to be as short as possible. We believe that with everybody's help and everybody's cooperation, this can be done. And again, I'll turn back and we'll turn to Dr. Brink in due course. We're fully aware of the provisions around what we've introduced and reclaiming some of the taxpayers' money that will be funded. Let me say this, beyond any doubt, beyond any peradventure, we're not looking to say if you get payroll co-funding that because you've made a small or nominal profit, you're going to have to repay the money. We want businesses and we want jobs to prosper. We want to keep businesses afloat. We want to keep people in employment. So the last thing we want to do is to be punitive. We've got to be realistic. There are limited finances. And what we're saying to businesses that don't really need the funding, and some businesses bounced back very well indeed last year after the previous lockdown and made significant profits, don't claim it. If you do need to claim it, claim it. We're also looking at the mechanism of getting money to you so that there will be gaps that will be bridged because we don't want people to have undue cash flow problems. So all of that has been looking at. Policy and Resources in full have already considered that discussion and will consider it again both later today and in the next few days. But the message is simple, as I say. If you don't need to claim money, don't claim it. But if you do claim it, and we'll do our best to get it to you as quickly and with as less bureaucracy as possible. Now, but again, because we want people, as I say, to keep their jobs, we want businesses to keep afloat. But I turn now to colleges, schools and early year providers. As we all know, they've been closed to everybody this week. The decision will be made shortly whether they'll be reopened or not for vulnerable students and for children of essential workers next week. That decision will be made in due course, but that won't be very long. There's a meeting of the Civil Contingency Authority this afternoon, and we'll be taking further advice then. I have to say it is much more likely than not that those educational establishments will be closed again next week. The reason for that is that there have been the outbreaks that people are aware of in the various educational establishments. We want to minimise those. We want to minimise the contact. We want to make sure that when children go back to school, they go back to a safe environment, both for them and for the teachers and for everybody else that works in those establishments. So please bear with us. We appreciate the difficulties that are being created. We sympathise with those, and we genuinely are saying to you that we'll get everything back as normal as soon as it's practical. Now, the single best solution for all of us, whether they're children or adults, is to stay at home when you can, to keep away from everybody else as best you can, and to help us get through this lockdown as quickly as we can. Now, Dr. Brink will be in due course, just in fact in a moment or so, just updating you on the strategy involved, where we are with numbers, what we're looking at. But as I say, I just countenance all of you, please. Bear with us. We're doing our best, and we intend to make this lockdown as effective as we can so that it can be as short as we can. I'm now going to pass you over to Dr. Brink.
So thank you very much, Deputy Fairbrush, and thank you very much, everyone, for joining us today. If I appear to be looking to my right, it's because I don't have the slides on my computer, and so I need to make sure we know that we are where I am with the slides. I understand these have all been emailed to you. I'm going to start off by giving you an overview of where we are. Really important that we keep everyone updated, and then go on to some more specific advice, and I think that's also important. So if we look at slide number 2, please, sorry, slide number 1, please. That's entitled Cases Starting the Week of the 25th of January. So you'll see there the data is from Monday to Wednesday there. Clearly, we haven't updated the data for today. Just to remind you all, our data sets go from 12 midnight of one day to 12 midnight of the next day. So in fact, this data was updated at 1 minute past midnight in the early hours of this morning. So what you can see is on the 25th, so on Monday, we had 461 negative results and we had 10 positive results. And again, on Tuesday, we tested, we had over 1,000 negative results, and we had 22 positives. Yesterday, we had 696 negative results and 23 positive results. So today we've seen more positives that clearly won't appear. So you'll see the 28th onwards appearing as 0 on that. Clearly, we can't predict into the future, but we've seen 10 positives so far today, and the contact tracers are working with those cases as we speak. So with regards to contact tracing, what we're doing is identifying the most urgent situations, ones where we think there's the greatest risk of onward transmission. We're looking at those and again, putting all the immediate self-isolation as soon as we can. So indeed, last night we were contact tracing till about 11:30 in the evening, sorting out the late positive results that needed urgent attention. So that's how we will get on top of this outbreak that we're seeing at the moment. It's that immediate self-isolation. So most important is self-isolation, and I'll talk more about that in a moment. So if we go to slide 2, the top part of slide 2 indicates our total results that we've seen. And as you can see, all in all, we've now had 414 positive results. That's from the start of the first wave that we saw when we saw our first case on the 9th of March last year. It seems a lifetime ago. But what I've concentrated on in the bottom part of the graph is what we've seen in the second wave. And these are the cases since the 6th of September. And at the moment, we have a total of 162 cases in that wave. And of those, 107 are active cases with 55 recoveries. We haven't had any COVID-associated deaths in the second wave. However, I do urge caution because there's often a lag phase, so we need to be continually vigilant, and that remains an ongoing theme for us. So if we go to slide 3, what we'll see is the case breakdown. So as always, we are interested in the unknown community sources versus travellers, versus the cases that we get from contact. And what we want to see is the majority of our cases being got through contact tracing. Now that's important because contacts are people we know about who are in self-isolation and so have minimized their chance of onward transmission. So that's really important for us. But I'll just go through Monday, Tuesday and Wednesday's data. So on Monday, we had a total of 10 cases, 3 unknown community sources and 10 contacts. On Tuesday, we had a total of 22 cases, with 12 unknown community source, 8 contacts and 2 travel. And Wednesday, we had 17 contacts and 6 unknown community sources. And that's really important, as I said, that we try and identify cases through contact tracing, but more important through the testing and identification of cases through contact tracing is if we do identify someone as a contact, that they go into self-isolation, because that will enable us to stop that chain of transmission. So that remains a recurring recommendation from us and probably, and one of the most important things that we're going to do over the next few days. Now I'm going to give a brief update on the educational settings. So cases that have been linked to a school, college, or indeed an early year provider. And this is now across 11 educational settings. So important again that we have new settings identified, and involves a total of 25 pupils and 15 members of staff. So again, it's important that we continually monitor the situation. Now, specific advice has been given to each educational setting. So what we've done is we've tried to do specific risk assessments. So if you recall, when we identified the first 2 cases, we did a lot of cohort testing. Now that was to identify whether we had a problem within the educational setting or whether these were individual sporadic cases. What that cohort testing showed us was that we had a number of cases across different settings. So what we now do is we switch to identifying a case and then asking that facility to immediately self-isolate, or the group associated in that facility self-isolate. Now we will be sending out specific messages to schools. If we identify a particular area of concern, we'll be messaging out that area and saying, these are our recommendations for this specific situation. And that's really important. So with some of the early year providers and some of the other schools, we've been asking people to go into self-isolation and come forward to be tested if they're symptomatic, but not doing broad cohort testing. We need to focus our testing capacity on symptomatics and indeed also keeping our critical infrastructure running. So that's really important. Now, if we go to the next slide, which is slide 5, that shows us the number of people that have been sampled over the last 4 days. So I've gone back to Sunday there, and what you can see on Sunday the 24th, we tested 644 people, and what we've done is we've looked at symptomatic versus contacts of cases, and then other. So others are preoperative, people that are testing as a part of day 13 testing, so people that are perhaps immobile, that we're going to their house, that we're testing for various reasons. So on Sunday, January the 24th, we had 293 symptomatics and we had 296 contacts of cases. And if you go down the days, on Monday the 25th, we had 261 symptomatics, 319 contacts. And on Tuesday, again, we had 297 symptomatics, 347 contacts. And on Wednesday, 369 symptomatics and 275 contacts. So the numbers vary slightly from day to day, but are roughly dividing between symptomatic cases and contacts of cases. And that's really important. Now, I think our level of positivity in the symptomatic cases is important as well. So all of that data we correlate and we look at on a daily basis. So if we go on to slide 6, I think I had a question from one of you about how much testing was being done through the GP practices, and we've collated the data of people who were sampled in primary care on slide 6. And what you can see is on Monday the 25th it was 86, on Tuesday it was 99, and yesterday it was, and they've ramped up their testing capacity. They have the ability to do sampling there, and they're working really closely with us. So it's important that we work closely with our partners, and we really are very grateful for the support that we're having from them. So the other issue that we looked at on slide 7 was the age breakdown. And we were interested to see, and this is about 18 hours out of date because I did it yesterday afternoon. And if you look at the age breakdown on the slides, we see that most of the cases are between 11 and 20 years old. And that basically reflects what we're seeing in the school settings. But we also have the next most common is between 31 and 40 years of age. And that's often the parents and teachers and so on. So we're looking at the spread across the age groups. We have had 7 between 71 and 80 years of age, and obviously that's always a concern because we know that COVID-associated morbidity and mortality is more common in older people, so we really want to try and get on top of this outbreak as quickly as we can. So if we move on to slide 8, there are 2 parts of this slide, and this slide has been devised in response to the questions that we're being asked. So we've taken typical scenarios and we've tried to map out very carefully what our recommendations are. So the first is, I'm showing some symptoms of COVID. Now these might be really mild symptoms, but If you are showing some symptoms of COVID, self-isolate immediately and telephone the clinical helpline. Really important, so that a test can be arranged. At the moment, we've got a very high volume of calls going through the clinical helpline, so please bear with us and be patient. But the most important thing is that you self-isolate. So you remove yourself from the community, from the people you're close to, so you prevent that onward transmission. Now, understand that it's not always possible if, for example, you have young children. So then what we're saying is self-isolate in bubbles, and that's really important. Now, if you test negative, so you've had respiratory symptoms and you test negative, you can come out of the self-isolation, but you need to follow the normal lockdown rules. But if you've been tested negative, so you've been tested as a result of a potential contact, so it's not just I've suddenly got respiratory symptoms and I've got no contact at all, but I've got respiratory symptoms and I'm a contact or a potential contact of a case, you must then still do your full 14 days of self-isolation, even if you test negative, because we don't know if you're going to subsequently become positive. So really important. So hopefully that clarifies that. And there are questions, people have been asking us these questions. So the second scenario that we're faced with, I've been in contact with someone who's tested positive, or I went to the Ship and Crown or Crow's Nest between the 18th and the 22nd of January. So if you're showing symptoms, the same rules apply as for scenario 1, so I won't go through those again. But if you're not showing symptoms, we're asking you to please self-isolate, and if you develop symptoms, then phone the clinical helpline. And again, you must self-isolate for that full 14 days. So if you develop symptoms subsequent, you need to phone the clinical helpline, but in any case, you need to do the full 14 days. And we really are asking the community to work with us on this. So if I go to slide 9, the next question that we posed is, I've been in contact with someone who might have been exposed to the virus, but who has not had a test, or who has had a test, but this was negative. So that person might have had a test and it was negative, but they might still become positive. So they might be in the incubation period of the virus. So we need to consider that person as being potentially infectious. So what I would say is follow the lockdown rules, stay at home. And I would say ask people to have an additional level of caution here. So avoid contact with people outside your house, including going to the shops for the 14-day period. So just have that heightened awareness so you can try and minimize your contact with other individuals. And obviously, if you develop symptoms, then contact the clinical helpline. So the final question is, I've had no known exposure to COVID-19, and that'll be the majority of islanders. So we're saying, follow the rules, stay at home unless you're going out for specific reasons that are within the lockdown rules. So that hopefully answers some questions that have been posed to us. The other question that we've had some messages on our inbox relates to vaccine usage. And I thought what I'd do is provide some precise data on this. So people have talked about, do we use any additional vaccine available if there is additional vaccine within the vials? The answer to that is yes. So with the Pfizer vaccine, we usually can get 6 doses of vaccine. And with the AstraZeneca, we can usually get 11 doses of vaccine. So what we do is we schedule for 10 and 5 respectively. However, we have a list of individuals, health and care workers and other priority groups. We have a list of people who are able to come in at short notice. And on average, we manage to get about 20 extra vaccines per day, per vaccination day. So we really are using the vaccine to its absolute maximum. And we think that at a rough calculation, between 80 to 90% of times, we can get that extra dose of vaccine out. So we're doing our best to use the vaccine as effectively as possible across all islanders. So I think the final thing that I wanted to conclude is looking at our strategies that we're following. So the main strategy is that of lockdown, so minimizing contact with everyone. Sitting below that is self-isolation. So if you've had contact with a case, if you've had any symptoms, Self-isolate is the next level of protection. So we can stop people who've got potential exposure or potentially are positive to be coming into contact with other people. And below that sits a testing strategy. But all the and work together to try and help us get on top of this current outbreak. So thank you very much, Deputy Fairbush.
Thank you, everybody. Thank you, Dr. Brigg. Now, in relation to the next speaker, it'll be Deputy Salisbury, and what she will update you on, amongst other things, will be a number of areas where the Civil Contingency Authority is considering its policies and new measures. So I leave Deputy Salisbury to deal with that now.
Thank you, Peter. I'd just like to start by thanking everyone for supporting us and staying at home other than for essential reasons. The roads are certainly getting much quieter now, and with that, it's been great to see many of you taking a walk and getting some fresh air, even in the grotty weather of the last few days. Just a word to drivers though, and whilst there is less traffic, just like last time, please keep your speeds down. We don't want needless accidents right now that put pressure on and increase the risk to our emergency services. What is different from last time is our strong recommendation to wear masks or face coverings outside your home. We don't know whether the UK variant is here, but we do know that it's more transmissible than the first variant we saw, and so we need to be extra cautious. So please wear a mask or covering like a scarf. We've been asked by quite a few of you, why don't we make this compulsory? Well, this is something that we will be reviewing later today when the CCA meet again. However, in the meantime, please do wear a mask or face covering. In particular, remember that shop workers are on the front line right now, enabling us to have the essentials we need, and it will help them not only feel safer, but have less chance of catching the virus if you wear them. Now, there's been a lot of chat about the use of quarantines, hotels elsewhere, and research is ongoing for what it could look like here. Initial discussions have been had with some colleagues on the Committee for Economic Development, and it will be raised with the Tourism Recovery Group later today. I should make it clear, though, that we're not doing this as a consequence of the outbreak and was something we were considering before last Saturday. We do not yet know how the community seeding started. It's just one other thing we thought was worth considering that might mitigate risk even further. Now, what we know best mitigates risk of spread, though, is good hygiene and social distancing. It is so important that you wash your hands thoroughly. Remember singing happy birthday twice, and when you sneeze or cough, catch it, kill it, bin it. And please keep 2 meters away from anyone not in your household. I'm sure for many of you, this week has brought back memories of those first days last March. Well, I'm going to bring back a bit more deja vu by just reminding you all about the symptoms of COVID-19 and what to do when you develop them. It's so important that you look out for them and know what to do when you get them. So the signs to look out for: new and severe fatigue, new muscle ache for no obvious reason, headaches, loss of smell or taste, sore throat, fever, shortness of breath and chest tightness, and a continuous new cough. When considering children and those over 80s, look out for diarrhea, mild fever, or something that makes you think they're simply not being themselves. If you or someone you care for starts experiencing any of these symptoms, however mild, please contact the clinical helpline on 01481 756 938 or 01481 756 969. We want to hear from you. We're prepared to hear from you, and arrangements will be made for all those displaying potential symptoms to be tested as soon as possible. But in order to make sure that we're able to do this, it is important that you don't try to book appointments unnecessarily. Anxiety is natural, but if you're not exhibiting symptoms and you haven't been identified through contact tracing, you don't need a test. All you're doing is making more work for a busy team and potentially slowing down our ability to get on top of things. We all know that if we follow the rules and work together to support Nikki and her team, our health and care services, our other essential workers, and our fellow islanders, we'll get through this and be out of lockdown sooner rather than later. We've shown what we can do, and I know we can do it again.
Thank you very much, Heidi. Now, I can pass you straight over to President of Health and Social Care, Deputy Berard, who will address you on most of the matters that are within his purview.
Well, thank you very much indeed, Peter, and a very good afternoon. This has been a busy week for health and care colleagues across the bailiwick, and I would like to thank all those supporting both our immediate response to COVID-19 and keeping key services operating at this time. From those in the scheduling and swabbing teams to those across primary care, keeping community and acute services running. Hundreds of staff are working exceptionally hard to protect our community, and I know that many islanders will have found that their health and care appointments are affected. And I'm sorry for any inconvenience caused, and thank you for your understanding and patience. In just 3 days between Saturday and Tuesday, 1 in 30 islanders were tested at the testing centre at the hospital, and many more swabs would have been taken for symptomatic islanders across primary care. This is a phenomenal undertaking in such a short period of time and would, in the UK, equate to some 2 million tests. The fact that we're able to do this is testament to how far we've come in the last 12 months and means we are well placed to respond to this pernicious virus. We're returning to different ways of working and socialising, which we adopted last spring. We've already seen how quickly businesses and individuals have reverted to using social distancing, and it's important that, in addition to respecting each other's personal space, we all adopt good hygiene. And while we know from past experience that we will as a community get through this, inevitably lockdown will be difficult for many islanders. Information is available on gov.gg in respect of the steps that we can take to access mental health support, look after our well-being and that of others. So do stay connected to those you care about, be kind to yourself, and reach out for support if you do need it. Thank you very much.
Thank you, Al. And last but not least, our Chief Executive, Paul Whitfield, will address you on some practical matters.
Thank you, Deputy Fairbrush, and good afternoon, everyone. The teams have recognised that islanders have become increasingly worried and simply looking for clear guidance. Dr. Brink has worked through this during this press conference, providing clarity over self-isolation and testing, and to explain how decision-making is related to this fast-changing situation. In terms of who we're asking to self-isolate, the net is now cast wide. So some islanders will have COVID symptoms, but in many cases, those isolating will not currently have symptoms. We're getting a lot of calls and emails and questions in relating to specific household arrangements and circumstances that have had islanders have been either asked to isolate or indeed have made their own decision to do so voluntarily until they receive confirmation as to whether this is necessary. Public Health cleared more than 800 emails yesterday alone of people waiting to hear back from us. This goes to show the volume of questions we're receiving. Across other service teams are also experienced high volumes of calls, from the vaccine centre appointments to business support, essential travel and general COVID-19 inquiries, as well as, of course, our JESIC clinical helpline. Please be patient and ensure the nature of inquiry is directed to the right helpline, as this will result in a better service for you and save valuable time for staff processing those inquiries. A huge effort from all teams at this extremely busy time. We're redeploying 15 more officers to support public health with those inquiries and resourcing up to support the online helplines where required. It's been a fast-changing few days. We've revised our strategy and we recognise advice at times has to change at short notice. Like many employers, the public sector is being impacted by staff having to self-isolate within their own teams. Equally, this is impactful for our frontline workers, as the public sector as employer must follow the guidelines like all other employers and islanders, whether in the hospital or whether in the law enforcement and police setting or in administration. The good news, in many other areas, business arrangements have already been quickly put in place over the weekend for services to be rolled back to remote working. And I can confirm that our services are largely working well despite some increased isolation pressures here too. Remember, the change to circumstances on our island only started from last Saturday. We have already redeployed over 60 staff to new duties focused on the COVID support effort. I must also stress that it's not just government services. I acknowledge that many commercial businesses who provide critical services are also working very hard to make sure they have resilience in their businesses and work through the new plans. As ever, our thanks go out to those working in our essential retail, especially supermarkets and other food and pharmaceutical outlets, and many other essential. In terms of public service, we're using our business continuity plans and redeploying wherever we can. In some cases, we are reviewing our continuity plans and engaging with businesses to provide advice and support if and where it can be helpful. It is a constant and evolving situation that requires tolerance and patience from us all. As ever, we can do this together. I'm not shy of saying our employees have put in a heroic effort in the past few days, as indeed they have for the past year. Please recognise these challenges. They're giving everything they've got for you and working incredibly long hours in many areas, doing the best to work through solutions, and most importantly, in the immediate term, keep us all safe. As Deputy Furbrush has said, we haven't a definitive answer on the situation for educational sites next week. It is likely to be similar to this week, and details as to whether there is any variation will be confirmed. As soon as testing capacity allows, we are ready to reopen school sites for the care of essential workers and vulnerable children. However, we must prioritise testing as our principal objective. To complement this, we are looking where we can increase swab testing capacity, utilising areas such as the East Harbour Arm facility, whilst we haven't got to cope with normal passenger movements. I would add distance learning guidance has been sent to all parents as of yesterday, and many schools have already begun their distance learning support before that. We understand thus far schools haven't been open to support the care of children to essential workers and vulnerable children, but it's essential to our strategy to suppress this outbreak as quickly as possible. This week has been one of the toughest since the pandemic began, and while today's case numbers are just one day, they are encouraging, and our objective is still a short, sharp and effective lockdown. Many of you will know my passion for rugby. As in the All Blacks motto, go in early, go in hard, and that's exactly what we are trying to achieve. And I thank you again for your continued support. Thank you, Peter.
Thank you very much, Paul. And using your sporting analogy, I'm a Tottenham Hotspur supporter, so we want to score our goal of success very quickly indeed in relation to this pandemic. We're grateful for everybody's efforts. We really are grateful. The community has responded as we expected to splendidly. We understand the questions and queries. But now this is the chance for the media, who I commend them for the way they've been dealing with these briefings over the past few weeks, because they're asking perceptive questions. And we give the first of those will be Ewan. Ewan, you want to ask a question? What would you like to ask?
Hello to everyone.
Hello, Ewan? Can't hear you. Got your hand up, but I can't hear you. I don't know if anybody else can. Well, let's come back. We'll come back to you. We'll give him his opportunity. We'll go to Juliet Puto. Juliet, have you got a question?
Oh, good afternoon, panel. Can you hear me?
Yes, we can hear you.
Excellent. You've mentioned about how obviously infections are affecting a number of different sectors. Have there been any positive cases among hospital staff at all?
I think we'll go to Dr. Brink, and then if Deputy Brewer wants to add, I think he can, but we'll go to Dr. Brink first. Hello, Dr. Brink, are you there?
Thank you. So I'm not going to comment on specific cases, but yes, there have been cases that have affected the hospital, which has meant that we've done some broad testing across the hospital, as our population would expect us to do. And it has meant that some of our staff are off on self-isolation. So we've been looking at all of this to ensure that our business continuity can occur in the hospital. I don't want to discuss specific clinical cases, but the answer is yes, we're managing it, and we're putting in business continuity plans.
Thank you. If Al wants to add anything, he will, but I think he's probably covered that. Thank you very much. We'll go back to Ewan. Ewan, are you with us? Can we hear you? Oh, we're having problems with Ewan, so we'll go to Kate Prout. Kate from Channel.
Hello, this is a question about testing. You obviously Paul mentioned the possibility of other testing facilities. Does that mean you are at full capacity at the moment because islanders are obviously concerned? How are you coping with it?
Paul, do you want to pick up that? And I'll come to Dr. Brink after. Paul?
Yeah, the testing facilities at the minute are coping admirably and well with the testing facilities, particularly up at the hospital. What we're actually looking to do is how we can expand that to deal with some of the larger cohorts, particularly in how we can get some of the school sites reopened, specifically for that larger cohort of vulnerable children with very special requirements, but also so that we can get some support network in for our essential workers. But we want to do that in a safe and controlled way. And clearly, we aren't quite there yet for that. So we're looking how we might utilize these other sites that aren't optimized at the minute. So we've got sites, as you know, at the airport and the port that we could use. But I'd just like to add, it's not an easy fix because people say to us, well, why don't you just test all the children in the same way as you're doing for everybody else? But of course, for children and in our essential workers, that's 310 children at primary school level wouldn't be tested in the same way as you are as an adult and need supported testing. So we're really going to think this through carefully and make sure we're not adding to risk. So it's extremely likely that we'll go to that next week, but we are looking at how we can supplement that with additional swabbing.
I don't think we need to go to Dr. Brink on that one. She's worked hard enough already. Matthew Leach, I think, Matthew, you've got a question.
Hello, Matthew here from the Bailiwick Express. Last time you mentioned 70 people or so that you couldn't contact for testing. What kind of number are you looking at now for that?
Dr. Brink, is that for you? Dr. Brink.
Yeah, sorry. Thank you very much. I don't have a precise answer for that, but the vast majority of people we are able to contact. Occasionally, what happens is that we phone them and they're in the shower, or they've got a really reasonable reason for not answering their phone. But they're not many, but some people don't answer their phones when we call them. Sometimes they've given the wrong telephone number, so there are a number of different reasons. So it's a handful of cases, not large numbers, but I couldn't give you a precise number.
Thank you. Paul, you wanted to come in?
Yeah, I just wanted to add to Dr. Brink. As we've had to spin up a large number of call handlers and additions to our system, a lot of the numbers come up on your mobile phones as no identified number. We would just express if you get those. I know normally not all of us like to answer those if we can't identify the caller, but just say in this case, please answer your phone if it rings, because it could well be the call line help number.
Thank you. Island FM for next. I'm not sure if it's the Venerable Jim Delbridge or if it's Rosie. But
yeah. Yes, it's me, Peter. Thank you very much. Yeah, Jim Delbridge here, Island FM. It's a question really regarding pregnant islanders. We know that there has been instruction that people attending scans and C-sections should come alone and not bring their partners. I was wondering if there was any background to this that could be explained, please.
Dr. Brink, I think that must be one for you.
Again, I'm not going to comment on specific cases. However, it's all about preventing contacts and mitigating risks. So it's all about reducing traffic, having as fewer people interacting with each other, and that is pivotal as we move forward to control this outbreak. So it's all about putting distance between people and having as few people in a space as possible.
Thank you. Al, Deputy Breward, and then I see Deputy Salisbury got a hand up. So we'll go to Deputy Breward first.
Yeah, I think it's absolutely right. One of the difficulties, of course, is in a hospital setting, it is even more important that we keep as many people as safe as we possibly can. And it's just to make sure that the risks are mitigated as much as we can, because if we do have an issue in the hospital, it can be quite severe for our ability to support islanders. So we're very sorry we've had to make this position, but it's just to make sure that the majority of people keep safe. And we are looking at some alternatives of using perhaps video or things of that sort that may be able to help.
Heidi, I think you wanted to make a contribution.
Yeah, I was just going to the last bit that Deputy Brewer just mentioned. I know there was been a request from the community about whether we could look at videos, and I do know that the guys at the hospital are looking at it. So yeah, absolutely.
Yeah. Now, Ewan, hopefully we've managed to amend the amendments between us and you. Ewan.
Great, thanks for coming back to me. Dr. Brink, a question for you. Interesting to look at the age breakdown of those who currently have COVID in Guernsey. There's no one included over the age of 80. Could this be down to those that have had the vaccine, or can that not be concluded from these stats?
Ewan, I'd love to say that yes, it's as a result of the vaccine, but I think it's where we're seeing the transmission occurring. Undoubtedly, the vaccine will help us as it kicks in. Most of our over 80s are being immunised. The over 75s are attending the vaccination centre now. As we get an increasing number of individuals vaccinated, yes, the risk profile will go down. But I think the current risk, the current age demographics that we're seeing are related to where the outbreaks have occurred. But you are right that our community will become increasingly protected. But I think it's a exposure issue at the moment rather than a protective issue of the vaccine, although that will become increasingly more important.
Thank you. We go back to Matthew again. Matthew Leach from Bailiwick Express.
You mentioned the spread is now across 11 educational settings. Are these settings allowed to be named?
I think they are. I think that information could be provided. Dr. Brink, is that right? I mean, presumably you don't want to read them all out now, but I think we can provide that information. There's no reason why we can't, is there? Just to check with Dr. Brink.
So from my point of view, it would depend on what our chief executive says, but I would be what I'd be guided by Paul on this one.
Okay, thank you very much, Dr. Brink. Paul?
Yeah, I think we've got to be transparent in it. We have it across a large spread of schools, and I think we should be clear on where. Obviously, we're not occupying those schools yet. There's small numbers in many cases, and I think Dr. Brink would also agree that most of them are through associated contacts, and we're certainly seeing a number of links from that, which is actually quite useful from the unseeded community type. But there is a list, and they are quite specific, and I think the best thing to do, rather than naturally talk through those all individually now, is to make that information available in a safe and proper way.
Thank you very much, Paul. And indeed, generally, as Paul's made the point, and so did Dr. Brink, we want to be transparent and give as much information as we can, as quickly as we can. So it's not hiding anything, but I think that's a very good question. Juliet Puto, what's your question?
During the first lockdown, I believe there were small business grants, which were a bit of a lifeline for some small businesses. That doesn't seem to have been replicated in the current package of measures. Is it something you're looking at? And if not, why not?
Well, we are looking at it, so it's not the why not bit. We are looking at it. As I said in my introductory remarks, P&R, in fact, had an informal meeting this morning. We're going to be continuing discussing things. We are looking at grants. It certainly will be part of the package, which will be refined over the next few days. Sorry, Heidi, you've got your hand up. Heidi.
Yes, thanks, Peter. I think it's also worth remembering that back in March, April last year, the business support measures didn't come in so early either. So it took several weeks for things to get in place. So what we're doing is seeing how the land lies, hoping for a short, sharp lockdown. But as we look at the evidence, it will determine how we look and consider whether other options might be suitable.
I think that's a very good question, because we want to appease business concerns and the concerns of people, whether they're going to get paid, etc., etc. Jim Delbridge, you've got another question, I think.
Yes. Apologies if I've missed this, and this has already been mentioned, but regarding the Ship and Crown, do we know how many people have been contacted there, or indeed they have contacted the authorities? Do we have any numbers on that, please?
Dr. Brink?
I don't have any specific numbers on that, but what we have said to people is that with the initial case identified, we wanted to do a scoping exercise because we wanted to see whether it was a single sporadic case or there were other cases. As you're aware, there are other cases involved. So from that perspective, we included the period of interest from the 18th until the 22nd, until Friday the 22nd. So what we're asking people is not to contact us, but to go into self-isolation and phone the clinical helpline should they get symptoms. So we changed strategy. The reason being is that there was more than one case. So it wasn't a single.
Dr. Brink, you've frozen Dr. Brink for the moment. So I should come back.
Yeah. That was the reason for moving away from a more specific approach, to an approach where we're asking everyone to do self-isolation rather than a targeted testing approach.
Thank you. Kate Prout, you've got another question.
Yes, hello again. Can I just ask about medical provision for the other islands in the bailiwick, particularly if there are any serious cases? How do you plan to get them over here if that is indeed the plan?
I think I'll come to Dr. Brink, but it may be Deputy Brard wants to give some thought to that too. But I'll come to Dr. Brink first.
So we're working closely with both Alderney and SARC in relation to this, and we've been liaised with their GPs, so people would be managed in the first instance within their island. So that would be the first port of call. So most people would get that initial management there. Should they require transfer out, that would be done in conjunction with our medical director, but also looking at how we could safely transfer people out.
Thank you. Al, do you want to add something? Yeah, can you unmute, please, Deputy Brard?
Yeah, just to add, the majority of people who seem to have COVID don't need hospitalisation. So it's just to give that reassurance that for some people it's not a severe illness. Obviously, for those where it does become severe, then of course the services are there to kick in to help.
Very much, Al. Ewan Duncan.
Another question for you, Dr. Brink, is obviously the testing and lab teams have done a fantastic job, and as Deputy Breward mentioned earlier, about 1 in 30 islanders have now been tested. But were you expecting this amount of positive tests to have been found, and do you expect many more to be found, potentially now that community cases could be contained?
The first thing is, yes, I do expect to see more results, more positive results. Undoubtedly, we're not out of the woods here. So the numbers of positive, I'm pleased that they're not going up exponentially, but I'm also not getting complacent. We are still seeing new community cases occurring, and those pose the risk of ongoing transmission. So we cannot in any way, shape or form be complacent. What we are seeing is we're seeing the effect of lockdown beginning to kick in. So the number of contacts we're getting per case are starting to decline. Now that's really important because it's those case contacts that end up in transmission events. So to answer your question is, yes, I do expect to see more cases. The cases are increasing. That's always a concern whilst we have cases of unexplained community transmission. And I think we've got to wait for another 3 or 4 days to see the efficacy of the lockdown process. So I think it's a bit early for me to provide precise information on that.
Thank you very much. Matthew Leach, your question.
Talking about testing, staying on that, do we know how many people are currently booked in and waiting for a test? Or what wait times people can expect?
So I don't have precise figures on that, but there are a significant number of people booked and waiting for testing, and that's why we brought an extra, when I say testing, waiting for sampling, so waiting to have their clinical sample taken. We brought in extra resources to try and get rid of that backlog. But I think also importantly is to start using our resources cleverly, and so our Chief Executive talked about opening the harbour port areas for self-sampling and looking at who we can actually send down safely for self-sampling. So it's the older people, so people above 12 years of age who are part of any broader surveillance testing we're doing. So we're hoping to move those down. So just restructure how we do that because we want to get people through faster.
Yeah, just to help understand a little bit further as well, we were looking at an average rate of about 1,000 waiting for tests. We were getting through 750, but the tests we've got to remember keep added to each day. So every time someone who's symptomatic that then requires a test or someone of a contact, those increase the list. So whilst we make really good inroads on testing on a daily basis, of course, they get added to. But on top of that, Once you've done an indicated initial test, you will most likely have, well, you will have a day 7 test, a day 13 test, all adds to the testing regime. So the testing regime for some time now will not get any less in terms of demand, because the more people test, the more we'll have follow-on tests until, as Dr. de Brink has described, it starts to plateau and hopefully we come down the other side. But we're not quite there yet.
Thank you. Juliet, you've got a question. Juliet.
Yes, I'm actually going to borrow a question from one of my fellow media. I think he's asked it a couple of times, but there hasn't been the detail. I just want to check, do we have any idea how many people in Guernsey are in self-isolation at this stage?
Dr. Brink, I see she's smiling.
I knew I was going to be asked that question today, so I did have a look at it. So I don't have a precise figure, but I think it's between 800 to 1,000 people that are in compulsory self-isolation. So these are people that are required to self-isolate. Now, there's an additional cohort of individuals who we've asked to go into voluntary self-isolation. So those are, for example, people at the Ship and Crown, attended the Ship and Crown and Crow's Nest. So they're the two cohorts of individuals, but it's between, of the compulsory self-isolation, it's between 800 and 1,000. Now, why I'm giving you a slight variation is the contact tracing process is ongoing. So we're continually then updating it literally on an hour-by-hour basis, but it's in that region.
Ewan, you've got a question. Ewan Duncan.
Question for Paul Whitfield. I've been speaking to some business owners and those that are going to be getting some support from the government in the coming days. A couple of questions from them are that last lockdown, were any state staff furloughed, and will they be this time? Also, they'd like to know, is it fair if they haven't been furloughed or they're still getting the same wage on reduced hours, that they should carry on getting their full wage and that others should not be eligible for business support?
Thank you.
Well, what I would say is there are certainly no staff carried over from the last or the first phase that were on reduced hours or on full pay. What I would say is I quoted some numbers today about 60 staff redeployment, and many will remember in the last lockdown we had orderly staff, baggage handlers, administrators working on our waste management systems, working on the recycling centre. We occupied our workforce as much as we possibly can. As we speak, given I did quote before, this only started and kicked off on Saturday. We are compiling a full and comprehensive report, so we know exactly where our workforce is. There's over 5,000 staff that operate the full range of public services. Our focus and attention, of course, is on immediate response to COVID, but we will be doing a breakdown as to how we redeploy. And in fact, I'm taking that to P&R on the 9th of February so they can see for themselves how we're effectively using our resources and our workforce.
Thank you much, Paul. Juliet.
Yes, I think it's been noticed by a lot of people out and about that the public toilets have obviously all been shut except for down by the bus terminus, I believe. I just want to check, why is it so important to keep these closed? And is there any concern that possibly people with health difficulties will be deterred from going out and doing their exercise because they might be caught short?
That's good, Trace. Heidi. Heidi, can you unmute, please, Heidi? Because it's...
I knew I'd be the only one to do that. Yeah, we know it's really difficult right this moment. And just to reiterate, what we're trying to do is have a really short, sharp lockdown. I know that other people are asking about bathing pools. Really, the harder we can do it now and go into lockdown now, the sooner we should be able to get out of it. And so Nikki's saying that the number of cases is not going up exponentially. In the next few days, we'll see how things are going. But I know it's really difficult. I can remember last time getting calls and emails from people who wanted to go out, but it was an issue for them. I'm really, really sorry. And we're doing this so as we can hopefully get back to normal as soon as possible.
Thank you very much. Paul.
Yeah, I just would like to support what Deputy Salisbury's just said. Shutting things like public toilets in itself is an inconvenience, but we've got to understand they are a hugely risky area of contagion. But also you then have to operationalize a workforce to clean them regularly. And I think we have to go back to our kind of principal objective, that this is about actually tackling this as fast and as hard as we can. So we're asking the community to say, look, we are not trying to do a workaround on everything we normally would in order that we can really hone down and suppress this COVID and get back to normal as quickly as possible.
Yeah, Matthew Lee.
This enhanced track and trace process is obviously very important, but do we know how much exactly it costs?
I doubt that we do yet, Paul.
Yeah, we initially set a quite a substantial budget of just short of 5 million across the whole range of our testing capabilities. That's the chemicals that we need, everything that you need to run the whole processing, the staffing. So we're still operating within those guidelines. Deputy Salisbury.
Thanks, Paul. I think it's also worth mentioning in terms of the investment. It is an investment. It's not just throwing money. We're not importing the facilities and staff to do it. We've created, and Nikki, it's one thing I know is very proud of what's been achieved there. The resources and the skills that we've got in the test, track and trace is phenomenal now, and that's held us in good stead, and certainly for this second wave.
Dr. Brink.
I think another thing that's been really important in the contact tracing process is the number of individuals that have returned to us that were with us in the first wave to help in the contact tracing process. So, for example, yesterday we had 12 Guernsey Border Agency people, reduced travel in and so on, who are trained contact tracers. The Orchard Centre is not seeing routine patients, just urgent ones. So in between that, they're contact tracing. Environmental health has sent people up. So the State's Analytical Laboratory has sent people up. They're also supporting the pathology testing. So a lot of it has also been, we've had all the resources back in their day jobs, so to speak, and they're now coming back in to public health to help us. And the whole of the Levocador office is now populated by people contact tracing. We're all socially distanced. We're all in our separate offices. We teams from office to office. I can often hear the person also speaking, but we're incredibly careful. But these are resources that within the states of Guernsey that are now being redeployed in an emergency situation.
Thank you. You and Duncan.
I know I've asked this question previously about bubbles, but it feels like with schools potentially closed next week, there'll be many families on the island who could possibly do with an extra pair of hands to help out, and having that one extra bubble, be it a parent on the island or someone else that can drop the kids off, especially if they're essential workers, might be really beneficial for them.
Thank you. I think I know the answer, but Dr. Brink.
Again, every bubble we create an increased risk of infection. So I think it's really important that we try and minimize contacts as much as possible. There are certain unavoidable situations where, for example, a child supports a person with dementia who's elderly. And those people, we work through a method statement with them as how they can do it safely. But overall, we just really want to try and prevent contact between people to try and minimize that transmission.
Heidi?
Yeah, and I think just to add to what Nikki said, we just have to see where the positive cases are in terms of the demographics. So it's really probably the last thing we want to do right now is spread bubbles with children moving from one place to another.
The other thing is with grandparents being part of the care. Don't forget that COVID-associated morbidity and mortality is mainly in older people. So we need to be cognizant of trying to protect our whole community.
Thank you very much. I don't see any other hands raised, so I think that's probably the end of our broadcast today. I'm very grateful to the media because the questions I've asked have been broad-ranging and, again, very perceptive. But I'm very grateful to the public of the Bailiwick because we need you. It is a severe lockdown. We want it to be as short as possible. And therefore, although people are quite reasonably asking, can we just extend that? Can we just have an exception here? The general answer will be no, because we want to get out of this as quickly as possible. Thank you very much for listening and watching. And as I say, we'll keep you informed, good or bad news, and let's hope there's more good news than bad news. Thank you very much, everybody.